Well, thanks, Sean. Well, let's just for the few folks that may not know your story, can you give us a little background on who you are?
Sure. So I trained formally in emergency medicine through the Army. I got a HPSB scholarship and really just concentrated on taking care of people that had acute emergencies and felt like anything that was in the preventive realm was boring and left for family practice and internal medicine types. So I would never even read an article or journal publication that pertained to prevention of disease or improving people's health. I was all about penetrating trauma and acute heart attacks and strokes, and that's you know, the kind of the adrenaline stuff that fuels a lot of emergency medicine physicians' perspective. But I ended up you know, encountering a patient that was you know, just optimally healthy, and I couldn't quite figure out why he was so healthy. First, he had just a really healthy glow about him, and I thought he had elevated bilirubin, but it was just, you know, his skin tincture was good. And I remember palpating his, percussing out his liver to see if he had like hepatomegaly. You know, he told me that at that time that he was eating the paleo diet, low carb, high fat, and that Sergey Brin had decided at just that year, this was back in like 2011, had decided to go paleo. And I said, well, what's paleo? So he told me about it and why Sergey Brin decided to go paleo, because he could see how it was behaving on the internet just from a data analytical perspective. It really validated that diet relative to how other diets were performing and behaving online. So I found that fascinating, and I instantly fell in love with a high carb, low fat paleo diet and pushed it to some of my medical colleagues. But I was shocked that none of them were interested, and I was. And so I started out paleo and continued on into keto when keto became popular. And then about 2 years ago, I found out about carnivore, which brings me today to you know, what I'm most interested in is researching the reversal of chronic disease, which I've done through a grant in the National Science Foundation. Was back in 2016 received a grant for the National Science Foundation to work on reversal of chronic disease, and then in doing that, looking at novel biomarkers in the body using an MRI scanner. We were able to observe that as chronic disease leaves the body, as measured by an MRI scanner, that people's appearance improved. They just looked better, and they started performing better. So I've sort of retooled myself now as a performance optimizing physician, and I enjoy working with motivated clients that really want to improve their human performance, and some of them want to improve their human appearance. And so I look for the most motivated. The more motivated, the better. I find them fascinating, and so I'm really happy to be carnivore and amidst the carnivore crowd, because I have found a lot more motivation in carnivores than any other approach to lifestyle and diet. So you're certainly a good example of that, Sean.
Well, I appreciate your what you do, Sean. I know one of the things you like to talk about is visceral fat, and can you explain to us what visceral fat is, and just for the purposes of, I guess, further detail, do you include intramuscular fat? You know, some people have the general topic of ectopic fat, which includes, well, all these things. So can you discuss how both of those are important or not important in health?
Sure. So I actually brought you know, this time, the last time I was on a show, I didn't have some models, but hopefully people can see in this particular screen. So this kind of shows a picture where we scan through people and their abdomen, and the image that's created. So this is a cross section through the abdomen. So this is kind of the back end, the back muscles, and up here are the abdominis rectus, your six pack. And in the center where it's white is all visceral fat. And the stuff in the periphery, the white that's in the periphery, is actually subcutaneous fat. So in the top photograph, it's the same image, just used with color. So the red is visceral fat and the yellow is subcutaneous fat. So that's a good example of where visceral fat is in the abdomen and how we scan it by MRI. Now, a little bit better in view, maybe here where my finger is a white streak in the oblique muscle and transverse muscle. So that white streak, I'll try to hold it still, is your ectopic fat. So you can see fat deposition by MRI because it shows up white within the muscular tissue. And so we see it in a variety of different locations. We can track it in the thigh muscle, we can track it in the pectoralis, major and minor muscles, various different muscle groups. So the two really bad players inside the body we see are the ectopic fat or intramuscular fat, the fat deposit within the muscle tissues, and visceral fat, and they correspond to each other. So to the extent that you have a lot of visceral fat, you're going to have a lot of intramuscular fat. And to the extent that you reduce your visceral fat, you'll reduce that intramuscular fat. Now, what's interesting, and I'd like to share it with you as an orthopedic surgeon, is that fat, along with that visceral fat, that fat in the muscle degrades performance. So just that deposition of fat, we can see people will walk different. They'll walk older. They won't perform as well. They will not have the coordination and the balance and the elegance that you see in a high performer. So one of the interesting manifestations of that same deposition of fat is the intramuscular deposition of fat within the tongue. And so people's inflection, their quality of their voice actually is impaired, and they start talking, as they get heavier, they start talking like this, and I call it the Bubba voice, and they get this big deposition of vascular fat within their abdomen, and then it starts influencing the inflection and intonation of the quality of their voice, and you can hear it as well as see their anterior posterior displacement of that visceral fat. So not too long ago, about a month ago, there was a study that showed hospitalizations, the length of time in the hospital and length of time of stay in an ICU corresponds to those two measurements, visceral fat and intramuscular fat. So they're really useful biomarkers and biometrics for evaluating people that have chronic disease and are more susceptible to illness, to include a multitude of forms of chronic disease, and certainly COVID. So great first question right out of the chute. Both really important areas that I'd love to study and use the MRI to quantify and track resolution of both. Oh, I'm missing you.
I have to unmute myself to
Oh.
remember
I thought I did something wrong. Boy, my hands got sweaty again.
How, from when looking at evaluating visceral fat, MRI versus ultrasound, particularly with like non-alcoholic fatty liver disease, I think ultrasound seems to be the more common, common study because it's, I suppose it's less expensive. But what is the difference in the resolution, the sensitivity, in those two modalities for evaluating, visceral fat?
Boy, is that a great question. So ultrasound is good because it's cheap and it's easy to do, and typically, and we like that as doctors, right? We like that as anybody who's interested in getting something better if you can find a cheap test. But here's the problem with a cheaper test: you don't engage the senses as much, and when you see a number and somebody looking at their ultrasound, it just doesn't make sense. You probably have done ultrasound. I was trained in ultrasound in my emergency medicine residency. I used it all the time as an ER physician, but patients really couldn't interpret it unless it was something obvious like a baby. So let me just show you a picture of a really good MRI to give you this difference. You see the tiny bit of visceral fat up here. Now this guy is super healthy, and I could show that to clients and tell them, hey, this is a really healthy individual. And then I could show them theirs after showing them healthy ones. And here's one that you don't have to go to medical school to see. This guy has got a lot of visceral fat inside of him. And this particular scan, actually, when I scanned this person and showed it to him, that individual actually syncopized. They passed out literally in front of me, hit the ground, passed out, because they were so upset of the amount of visceral fat that they had in them. And to kind of contrast that, you see the subcutaneous fat, that was the only thing they could really feel. You know, they could, you know, you pinch the inch in your abdomen, and you can kind of see, you know, how much subcutaneous fat you have. So he was walking around thinking he had very little fat until he came in and had his MRI. And I like to tell that story to let people know that, you know, you have to engage your senses. And so it's more than just a number on a report, like what an ultrasound might report in terms of quantified visceral fat, or a DEXA scan may report in quantified visceral fat. Now, a DEXA scan will give you a visual image, but it's not optimized in the way that you can see, you know, this huge amount of visceral fat. So I like, when I work with my clients, I like to engage their senses, have them feel, have them see, have them smell, have them hear, because biologically, that's how we know how to perform and what is good. We operate through our senses. So to answer your question, I think ultrasound is cheaper, but it's not as impactful. So it just doesn't motivate people as much as an MRI. And I work with an MRI. I find it interesting, but you know, I don't have any financial interest in the MRI industry. I just think we ought to look at and use whatever is best to help people get healthy. So I find the MRI more motivating than a DEXA scan, an ultrasound, or certainly bioimpedance and some of the other more available modalities that are out there.
Yeah, somebody was asking about, do you see the opposite, someone with quite a bit of subcutaneous fat but very little visceral fat? Is that, do you see that very often?
I sure do. What a great question. So props to that person that asked that question. So the typical population we see that in are premenopausal women. So I like to kind of lump them all together. You know, they're your soccer moms, and so they typically will accumulate more subcutaneous fat than us guys. And guys, you know, from the teens on, we're accumulating visceral fat, and we may not be aware of it. And the women, because of the afforded protection that comes from their reproductive cycle, we believe, accumulate more subcutaneous fat and less visceral fat until they hit menopause. And then they start accumulating visceral fat, unfortunately, at a faster rate than men do. So they quickly catch up, so that advantage that they had previously is lost upon them. So yeah, very commonly we will see a lot of subcutaneous fat with a minimal amount of visceral fat in premenopausal women, and it's an interesting population. But as they get older and hit menopause, that all changes.
What is the so other than having visceral fat? I mean, and I think most of us intuitively know it's not a good thing. But can you lay out more explicitly why it's important? What conditions does it sort of predict or lead to, or why are we concerned about having visceral fat versus subcutaneous fat?
Yeah, so a really good analogy, understanding about visceral fat is you basically thinking of it as a gland. It's not a gland that you're born with. It's a gland that develops, but it actually is metabolically active. So it is actively secreting metabolites, and one of the products it secretes that's a big player that's in the news now are cytokines. So we're hearing a lot about cytokines. We've known a long time about them, you and I, as MDs, and the role that they have with inflammation and causing pathology. But it's particularly trendy right now with COVID because of what is known as cytokine storm. So it's a huge release of cytokines that end up overwhelming the body's normal physiological tissues and systems, and causes a dysfunctional condition, leading oftentimes, unfortunately, to death and very serious critical conditions. So it's these cytokines that are contributing to the degradation of normal healthy tissue. And so as you are accumulating this effect over lifetime, we see the effects and influence through visceral fat and particularly the mechanism of cytokines beginning to destroy joints. So DJD, degenerative joint disease, degenerative disc disease. You see destruction of other body systems to include metabolism, diabetes. We see its significant role with type 2 diabetes, excuse me, in particular, myocardial infarctions, heart attacks, and strokes through atherosclerotic cardiovascular disease. So these cytokines, travel through the body and play a role in worsening, in my opinion, every pathology I've ever seen and encountered in all of my patients that we've had that have come through our research practice. Every condition has improved as we have worked with those individuals to reduce visceral fat. So just the common pathway of inflammation that we see with disease makes it almost a ubiquitous player in every form of pathology. Maybe the one exception being maybe genetic disorders where people are born from their time that they're born with conditions. They may have less of a influence by visceral fat with that particular condition, but we haven't had many of those individuals. But certainly the chronic disease, all the different manifestations of chronic disease are improved by reversing visceral fat and worsened by visceral fat, and less so with subcutaneous fat. So we just haven't seen a tremendous improvement in just reversing subcutaneous fat. It's a little bit like having somebody stop carrying extra weights around with them. But boy, visceral fat, when that goes away, tremendous improvement in diseases and human performance and human appearance. So fortunately, as you start making healthier choices, living healthier, the first fat that disappears is the form of fat that is most destructive. So it's your visceral fat, your ectopic fat, your intramuscular fat deposition within muscles and other soft tissue bodies. So that's good news for everybody listening, so that as you make those choices, you're not starting with the subcutaneous fat that has less of an impact on your health. You're starting with the one that really, the bad players. And also pericardial fat around the heart is another really bad player that we see very frequently in our practice.
Hey, Sean, are there things we can do differently that affect visceral fat versus subcutaneous fat when we're looking at lifestyle modifications, or doing the same things basically affect them both equally?
Yeah, so what we have found out is as you make the lifestyle choices going on a lower carbohydrate diet, and the lower your carbohydrate intake, the more dramatic resolution of visceral fat and intramuscular fat and pericardial fat. So I'll just take a moment to show what pericardial fat is. In this particular study, you can see an individual here in the center of between the right and left lungs, the dark oblong shaped objects on the periphery, and then center is the heart, and they're surrounded by a large white area of pericardial fat. And in this individual, he just cut out carbohydrates, processed carbohydrates, and in the second repeat image, which is done only in 13 weeks, you see dramatic resolution of that pericardial fat, large chunk of highly inflammatory fat around the heart. So the intervention that worked to reduce that person's pericardial fat is the same intervention that would work to reduce visceral fat. And in that case, it was just eliminating processed carbs. He didn't exercise 1 minute, not 1 minute. And the same individual's visceral fat resolution is seen here. So I started off very large amount in this particular image here, and in just 2 weeks, time period, you can see from here to this image here, he's gotten smaller. And that's why I like these MRI images, because you don't have to go to medical school to see that. Patients can really see that. And then by the time he's down in this particular image here, he's really changed his amount of visceral fat, and his whole body shape has changed. So to get back to answering the specific part of your question, really just starting out eliminating carbohydrates, eliminating processed foods, sleeping better, and then adding in high intensity exercise, resistance training like lifting weights, and I like gym rings and calisthenic exercises as well. Doing those things will add to and accelerate the loss of visceral fat, as will fasting and doing other things, getting sunshine, optimizing your vitamin D. And you'll see resolution of visceral fat, pericardial fat, and intramuscular fat. And as those continue, eventually subcutaneous fat will start to be eliminated. But the first things initially you see is significant resolution of that visceral fat. So in this particular case, you can see his subcutaneous fat is the yellow, and it stays pretty consistent throughout until towards the end you can see it's lower. But it's not significantly lower. You can see what the big change is in the visceral fat. So what would have helped this guy with his subcutaneous fat is if you wanted to focus in on it, we have clients that really want to get rid of the subcutaneous fat. Maybe they're models, a variety of different reasons they want to do that, is making sure that they increase their amount of exercise. So we get them sprinting, in my opinion, is the single best form of exercise to eliminate subcutaneous fat. And that's one of the strategies we'll employ to work with people that are interested in getting rid of this subcutaneous fat.
Sean, what role does a caloric surplus have in accumulation of visceral fat? I've seen a number of overfeeding studies now, and they show that overfeeding of saturated fats leads to increased intrahepatic triglycerides, increased production of circulating ceramides. Again, this is in the context of caloric, excess. Now you talk about fasting, you talk about exercise, you talk about cutting out carbohydrates. Do you feel that there is a caloric reduction having an effect here, or is it purely just carbohydrates?
I think it's purely carbohydrates as the more significant driver with regard to hepatic fat, visceral fat, and pericardial fat, and the more pathogenic markers that we track by MRI. Certainly, the caloric excess really has, I'd like to see that particular study. Because I'm not a big believer in calorie in, calorie out. I think there's a big difference between certainly that we have seen by MRI when people consume a lot of processed carbs versus a lot of calories from saturated fat. It definitely makes absolutely a huge difference in the type of pathologic fat like visceral fat that we see. So I think those studies probably need to do a better job taking a look at using the MRI to take a look at that. Now, I can understand that maybe some of the triglycerides and some of the other laboratory values may be reflected in excess amount of calories, but I think it fails to appreciate the contributions of the types of calories that go in. And then lifestyle. I think if you're just going to look at in isolation one particular influence from excess calories without understanding the role and the necessity to exercise, we are biological Homo sapiens that have to perform, and you have to be able to you got to do two things. You got to be able to run extremely fast, and you have to be able to fight. You have to fight and defend yourself, defend your offspring, And I just think it's a myopic view to look at science without looking at the interdependence of these relationships between diet and performance. So yeah, feel free to send me those studies. I'd like to take a look at them. Oops, you're muted again, Sean.
Yeah, I've got this study actually pulled up here on my phone. I was reading it last night. It's basically, it's 2018. It's called "Saturated Fat is More Metabolically Harmful for the Human Liver Than Unsaturated Fat or Simple Sugars." It was a 1,000 calorie overfeeding study done in already obese patients, and so interesting results. You know, they saw something like 55% increase in intrahepatic triglycerides in the saturated fat group, 15% in the unsaturated fat group, and then 33% in the carb group. So in that particular study, it was an overfeeding study. 1,000 calories is quite a bit. So I would just point that out. So interesting to see that. It was a 3-week study, and I can't remember how they assessed it, probably ultrasound. But anyway, you know, because one of the caveats I see with this carnivore diet is it's very difficult to overeat. That's one of the things that we don't see people getting into that 1,000 calorie excess, although those people are out there and I have seen it, but it is certainly not the norm. And so, but I do agree with your point of looking things in the holistic picture, because there is, you know, sometimes the laboratory studies are very contrived in what actual humans would do, and particularly I like to call them wild type humans, you know, humans in their natural state and setting, which is what probably allows us to function better, just like any other animal. How rapidly, well, you put a series of pictures up there, and for those that don't, because I mean, a lot of people aren't used to looking at MRI. I mean, obviously, you know, I've seen a lot of MRIs. I'm used to looking at the different structures, but you outline in red the visceral fat, yellow is the subcutaneous fat for those people that still don't get that, and then, you know, trying to figure out what the structures are, if you're not used to looking at them, can be challenging. You have this information on your website, on your social media for people to look at. I've seen you post that because somebody was asking about if they have a place to compare that to, because those are, as you say, very powerful images. You know, when you have somebody that's lean, you know, maybe they've got very little subcutaneous fat, and they have high levels of visceral fat. And some people call that thin on the outside, fat on the inside, or skinny fat. What is usually going on in that situation? Are these people just eating their own diet? Are they, you know, not exercising? What are you finding to be common in that particular population?
Yeah, so we call them TOFIs, thin on the outside, fat on the inside. And it's been my experience that those are individuals that are overfeeding in carbohydrates typically, and doing a lot of kind of chronic exercise. And the other, and this, you know, it's been a topic of some controversy, is with vegans. People that eat a lot of, you know, that tend to eat a lot of carbohydrates. As they age, their metabolism and ability to metabolize efficiently is compromised, and so you see this accumulation of visceral fat within these individuals. So TOFIs, the individual with a very large amount of visceral fat that I showed you that passed out, that individual, he is thin on the outside, fat on the inside. He was not a vegan, but he ate a lot of a very large high carbohydrate diet, and this is that image here, and this is a good example of a TOFI because the subcutaneous fat is so thin. See the little white layer that goes around. We paint that in images a lot as yellow, just to kind of, you know, it's cautionary, but the red is the kind that causes disease and causes death. So, and that's the stuff on the inside. So these TOFIs, besides being present in vegans and people that just eat a lot of carbohydrates, I've seen a lot in marathoners, ultra distance runners. I'd love to scan Zach. Now Zach, Zach may just be super healthy, Zach Bitters, because, you know, he eats a healthy diet, but you know, the chronic churning through carbohydrates and lots of cardio and a lot of distance running we've seen in a lot of ultra marathoners and marathoners, TOFIs, that they end up accumulating, unbeknownst to them, a large amount of visceral fat within their abdomen. So you know, it's something to be aware of, and you could be a TOFI and not know it because you think you're thin until you get the appropriate analysis to actually quantify and hopefully ideally visualize the amount of visceral fat that you have inside of you.
Yeah, I mean, there's been some recent research out there looking at cardiovascular events in these chronic endurance athletes. So do you suspect that may make up the same cohort of those people that are having these cardiovascular events because they are, constantly, plowing through carbohydrates and then constantly trying to run or cycle to, keep up with that, I suspect.
Yeah, I think so. And this actually is a really good study that we did. It's one of my probably my all-time favorite study. And so what this shows are those blood vessels that we can image by an MRI. And in this particular image, we're looking at cerebral arteries, or commonly brain arteries in your brain. And this particular structure is called the circle Willis. So you see blood flow really good in these dark, nice vessels here that are patent, wide open, but it gets really hazy here at this little distal section right here, and that's because there's atherosclerotic cardiovascular disease forming in that distal section of what's called the middle cerebral artery. But on the other side, you can see it's totally hazy because that particular lesion is so large that very little blood is going through. Now, it does go through a little bit because it trickles through, so it is not completely clogged, but that's significant. And what's interesting in this lesion where it's clogged, just 9 months later, it's opened up when that individual went on a high-fat, low-carbohydrate diet. They started sprinting. They started sleeping, optimizing their sleep, doing a number of things. But I would have to say the most important thing is, in the majority of our clients, they do a lot of things, but the single most important intervention that I've seen to date is diet. What they eat. And so we see these fantastic results in resolution of visceral fat, pericardial fat, intramuscular fat, and also resolution of atherosclerotic cardiovascular disease in just a short period of time, 9 months, which is shocking. I don't, we're not used to this, Sean, in medical school and your training. I mean, have you ever seen doctors, looking at vessels and reversing them? I mean, we do reversal on procedures with angioplasty and stenting procedures, which open up blood flow, but those come with a risk. And I think we really need to be promoting looking at safer interventions other than using drugs and procedural interventions. I know you're a surgeon and you're training a surgeon, so you want to go in and cut and fix. But I think we need to give our clients, give subjects, individuals, the opportunity to change their lifestyle, through diet and exercise, and the tools that they need to be able to see that this is working. So it's important that I think we train physicians, we train individuals to understand mid-levels and PAs and nurse practitioners to understand more safer ways to reverse disease and improve outcome, other than something that is designed to make a lot of money, like a angioplastic procedure or stenting somebody. But yeah, I think you're exactly right. I think a lot of these oftentimes young runners that are distance runners that suddenly drop with a heart attack, it's because they have elevated visceral fat and they have atherosclerotic cardiovascular disease. And I've seen them personally myself come into my ER. And I was formerly a medical examiner with the state of Virginia, so I've put these individuals in body bags that we've encountered, and sudden heart attack, and people will say, well, they were young and healthy and they did everything right, and they ran all the time. Well, No, they didn't do everything right. They weren't healthy because they're in a body bag. That's what I tell them. There were some things really wrong, and hopefully, through uh, education and awareness of the low carbohydrate, high fat methodology to eating, we're gonna, like we're making, I think, progress in helping people understand that fat is not bad, that there are, much healthier forms of fat out there, and eliminating carbohydrates. And but I think we can't just educate. I think we have to give the people the ability to evaluate and see how that is improving. So MRI is one way of doing it, but the other kind of area of passion that I have are looking at changes on the body, the external part of the body. So, following natural cutaneous-based biomarkers that I've only recently become intrigued with, I think offers potential in the future so that people can stay at home and see their themselves getting healthier. So things like resolution of spider veins and telangiectasias, which are manifestations in the skin of endothelial dysfunction, meaning the cells that line the vasculature within the human body, these thin one-cell layers of endothelial cells become disrupted, and they are essentially leaking. And in the same way we found out about epithelial dysfunction, leaky gut in the gastrointestinal tract, which is now finally starting to go mainstream. I think the next understanding is going to be having people understand endothelial dysfunction, leaky vessels, that we are seeing a lot of recent studies in COVID, the endothelial dysfunction being a common pathway for, unfortunately, higher morbidity and higher mortality associated with COVID. So yeah, blood flow, blood flow, blood flow. I tell my patients, get your vessels as healthy as possible. And the number one recommendation I make is cutting out carbohydrates, especially processed carbohydrates. I get them on a carnivore diet. I recommend everybody give it a try and see how they respond to it. And unfortunately, it's been very well received. We've had great results.
Hey, Sean, I want to go back to, and you provided this tremendous information, that little sort of soliloquy there, I suppose. The point about reversal of vascular disease, looking at circular Willis anatomy, with some of these vessels that are on the brain or in the brain. Our sort of vegan colleagues will say the only diet that's ever been shown to reverse vascular disease is a low fat, they'll try to imply a vegan diet, but a Dean Ornish style diet, which is low fat, lifestyle related. You are showing, and I would like you to clarify, how many patients have you seen this in? You're showing clear reversal of vascular disease with a low carbohydrate approach, and obviously with some other lifestyle modifications. So how many do you see that? How frequently do you see that? And is there any intention for you to publish this data, because this is very important?
Yeah, no, I totally agree. I've been challenged a lot on the internet to publish it. So we'll probably do a case series, maybe a case report on this one particular individual, because it was so dramatic. But we've seen this in about a dozen of patients. We've scanned over 4,000 people, Sean, for visceral fat, and we didn't start studying this one out of the blue. The reason we got involved in this is because people were telling us, as we got rid of visceral fat inside of them, that their memories were improving, and they felt like their cognition was improved. So a lot of our clients are C-level CEOs of corporations that want to perform better, and we could get them performing better by getting rid of visceral fat. And they said, well, there's something going on in the brain. What's going on when you lose visceral fat? So we decided to start scanning people to take a look at, not sure, what we take a look at and see. That's when we found these lesions were present and they were opening up. So about a dozen people, we've seen that. That's not a lot. But it's late in the game. We scanned thousands of people with visceral fat, so it took a while for that biomarker to be identified through anecdotal experience of people reporting. But one of the interesting things I'll say about opening up those arteries, the vegans tout it. I think that they do get those results. They can. I've seen those cath images that Ornish and Esseltine puts out there. But I think it's from the fact that these people that go vegan very oftentimes will stop eating processed foods. But if you continue to eat processed foods and continue vegan, I don't think you're going to get those results. And certainly our clients are cutting out processed foods. But I have never seen MRI atherosclerotic cardiovascular disease, that kind of resolution is seen with a vegan study. I'd like to take a look at it. And the other thing I'll just say to the vegan community is that's happening, and hopefully, and I don't know how good this resolution is, but can you see my pulse right there, Sean? Pulsating right there, my brachial artery? Is the camera, the resolution good enough to see that? I don't know if it's if the camera's on it, but my brachial artery is pulsating right there. I have maybe are you on mute, Sean? Oh yeah.
Yeah, I'm on mute. Yeah, I honestly I can't say I can see it, but
yeah. So the camera resolution is bad, but if you go on my YouTube channel, Dr. Sean O'Mara on YouTube, I have nice high quality videos showing these my brachial arteries on both sides, my radial arteries, and even at times my ulnar arteries are wide open and patent, and so you can visibly see these pulses, and you can't see these in average individuals, but it happened to me, and I paid attention to it. I started tracking in our clients that as they went on, did all these interventions, eliminating chiefly carbohydrates, their arteries would open up and they become visible. And so you can see an improvement of arterial compliance. And I have yet to see that in a vegan. But if you're in the carnivore community and you don't see your pulses, don't feel like it's not working for you. I practice a very different approach to health optimization than what is followed by the average carnivore. I have my clients and I do 25 things. So yeah, I get them carnivore, but then there's 24 other things I get them doing that really open up those arteries beyond. And I know you're doing one of them, high intense weightlifting. So that's a really good thing. But the more better you are at living, the healthier you're going to be, and the healthier you are, the more obvious these changes are in an individual. So you'll see visible pulses. So it's a really a cool finding that we're seeing in our clients, and I'm always excited to share it with people, because I tell them, get really healthy and watch your pulses become visible.
Question, and I'd like to get into more of the 25 things if you don't mind sharing a few of them, but relationship between waist to height ratio and visceral fat, how good of a relationship is there so the poor man? I know you've had some poor man's techniques for estimating visceral fat, so can you talk a little bit about those?
Yeah, so I think there is a correlation. So the first thing I like to tell people about is, if you can't afford to have an MRI, a really good marker you can infer for visceral fat is what's called the sagittal abdominal diameter. So if you simply lay down on the floor, lay down on your back, put your back to the floor so you get rid of the airspace, and you just measure the diameter of your abdomen while you're laying flat on the floor on your back, the height of your abdomen sticking up, you can infer the amount of visceral fat that you have in there, because visceral fat is different than subcutaneous fat in terms of physical properties. It has a higher density and a more gelatinous quality to it, so it will stick up in the air like a mountain. Versus women, in our female population that are premenopausal, if you have a big kind of belly around you, when you lay down, that subcutaneous fat will roll to the sides and settle down and not have the same quality large abdominal diameter. So when it comes to height to waist ratios, it unfortunately doesn't take into good consideration the difference or the contributions between subcutaneous and visceral fat. So I like to isolate the contributions by exploiting the physical characteristic of visceral fat being different by sticking up in the air when you're laying down to help people figure that out. So the poor man's MRI, you know, in essence to measure visceral fat is that that height, that abdominal diameter when you're laying down, and you infer resolution of visceral fat, hopefully, by laying down and tracking the difference, your abdominal diameter as it shrinks over a period of time. So track it and measure it. You can use a ruler. I measure a ruler, but I remember I had one RN that had a recent stroke. I mean, she had a bad MCA stroke, and I was trying to measure her visceral fat, and I brought I made a little device with a ruler. You know, it was kind of a cool little thing that had the ability to slide up and down on a ruler, but it was only 12 inches. And when I started to measure, I realized that I needed something a lot bigger, more like a yardstick, because her funda, you know, that height, that abdominal diameter stuck way up in the air. And it was so visibly apparent to me why this lady had a stroke with that enormous amount of visceral fat. She was just in her 60s. So yeah, I think it's a great question, so that people in the community here that are interested in maybe looking at how much visceral fat they have, particularly if you're just getting started with the carnivore diet, you're going to see that quickly reduce as you lay down there. So I have done a few videos on this. So if you go to my YouTube channel, Dr. Sean O'Meara, you can click on those videos and I walk you through how to do it.
Yeah, there used to be something, and I say used to be kind of tongue in cheek, because we talk about a scaphoid abdomen. And so that would be, you know, when you lay down, your belly actually goes in rather than sticks up. And that's so rare these days because so many people have these, you know, big bellies. So, I mean, just to be clear, you know, you're laying down back flat on the ground. You take a ruler on the side next to you, and you see how high that sticks up. Is there a number you're looking for? Because obviously a tall person is going to have a little bit bigger diameter than a smaller person. So I don't know that there's an absolute number you can look at, but what's a typical, let's say the average size guy, what's a typical height off the ground? We're looking at the you know, the top of that.
So that's a great question, and really the value of that test really is dependent upon an individual having a fairly large amount of visceral fat. So you really won't be able to, the sensitivity of that test, the ability to capture the resolution of the disease is substantially limited in an individual that has very little visceral fat. So if you're somebody who is pretty lean and you don't have you know, a large width around your abdomen, you're not going to be able to see much visceral fat. So you're going to need to have an MRI scan to be able to track that. But you know, to your point about that scaphoid abdomen, you know, something else that I have figured out with time, which is interesting, is I used to have that scaphoid abdomen, and I used to be kind of proud of it, you know, because it sunk down, you know, it just, you know, scalloped down, and I would take it and I would show clients, you know, patients, this is what you want to have. You know what? They look at me like this, you know, kind of a look like they didn't like it. And I started to realize, you know, that isn't a really attractive look. And then what I realized, what is attractive is that level abdomen. So when you lay down, you really basically want that same height from the sternum, you know, your intercostal margins and your sternum, all the way to your pubic symphysis, a nice flat line. And when you get that scaphoid, what's happening? Myotonia. So decrease of that muscle tone. If you do an abdominal exam, and I don't know how often an orthopod does an abdominal exam on a young, healthy person, but were you to do, and if we have any physicians or practitioners out there that do abdominal exams, young, healthy teenagers and people in their early 20s, you know, their abdomen is very firm. I mean, you have to sometimes tell them, well, come on, relax your abdomen. I got to try to feel your colon and feel your appendix. And they're like, well, I am relaxing. They have such tonicity to their muscles, you know, when they put their arms up, they have great tone. It's in their abdomen. But when you age, you get sarcopenia. So that's one of my markers. I do a video on this, is to detect sarcopenia. Is you'll have this relaxation of your abdomen, your muscles are relaxed, and then when you stand up in that anterior plane, this abdomen starts protruding out. And a really nice example of that image that I think is very obvious in myself is in this image right here. So in this particular image here, you can see that relaxation of my abdomen anteriorly. You have a little bit of a pot belly, and this is me about 3 years ago in this particular image. Let's see if I can maybe turn it like this, a little bit higher. And the image right here, you can see that belly sticking out because sarcopenia is present. Now, I go carnivore, really start sprinting, doing you know, a lot more things to optimize my health, and my whole body habit has changed. My musculoskeletal alignment has improved. Even the shape of my hopefully that's showing up. Even the shape of my head is better here than here. So this is a reflection of how when you get healthy, you decrease sarcopenia and you improve your appearance. So I like to tell people health is best revealed by two markers. One, how you appear, and two, how you perform. And it's not just about laboratory values. I think laboratory values don't take into consideration the appearance of somebody and how they perform. But you know, through dietary lifestyle optimization, you have this dramatic change, and clearly the sarcopenia that's present here is reversed, and I have much better posture. My abdomen no longer is relaxed, sticking out. If I go down and do on my all fours and do like a cow position like yoga, in the past my belly would hang down. Today I'm super proud. My belly does not hang down. It's nice and flat, straight across. And I think that's an important point to educate your audience about, that sarcopenia is something you should be paying attention to, be very worried about as you age. But if you are carnivore and you're doing high intensity exercise, those and the other things that I like to promote, it has a dramatic ability to slow and arrest the influence of sarcopenia.
Yeah, Sean, I mean, obviously, you know, diet, exercise, sleep, sun exposure, stress mitigation. Are there any sort of things that most people don't think of that you would consider helpful for optimizing health, I suppose?
Yeah, so you know, insulin sensitivity is a really big area, and that's really gets into diet and so many other things. But you know, I'll just cut right to the chase. You know what your community and most people are not paying attention to? And it's just because we don't have enough research. It's the microbiome. If you want to move ahead and you really want to make significant contributions to your health, stop thinking about yourself as one organism. You are better understood as a collection of organisms that live on your body and live with your gastrointestinal tract. And I get passionate about this, and I'm almost irritated because, you know, I see in medical school we're not paying enough attention to it, teaching doctors, and even those, you know, of our colleagues, Sean, like you and I, that are out, you know, trying to get people healthy. I think we've done a very poor job with investigating the microbiome and the role it has. But as you go carnivore, I've seen it. You talk about it, and your guests have talked about it. Cynthia, Fast Over 40. Who? She's an awesome sprinter, and we follow each other. There are so many studies that are starting to look at carnivore and what you eat, but also your lifestyle. Just, you know, sleeping well will improve your microbiome. So I think the future report card is not going to be laboratory studies, and certainly not going to be cholesterol. It's going to be your microbiome, and we'll be able to take a look at your microbiome and tell you, you know, how good of a job you've done. I think NFL draft picks in the future analysis will be, you know, yeah, looking at how they perform, but we're, you know, on the combine, but they'll also be looking at more science, like let's pull up that guy or that girl's microbiome and see how well they've lived their life, because the better your microbiome, the better you lived your life, and the better you're going to continue to live your life. So yeah, we don't know a lot about it, and we haven't even sequenced all those microbes, but that's not a reason to ignore it. You know, the healthier you live and the healthier your decisions, the better you make contributions to your microbiome. So I try to post on the microbiome, but it gets the fewest likes. I mean, it gets the least amount of comments. People are not as interested in it, but it's up to, I think, us as optimizing physicians interested in really promoting optimized health to start, you know, trailblazing the importance of the microbiome. So that's a big one that I spend a lot of time with my clients on trying to optimize them. And I attribute microbiome optimization to making a significant contribution to improving the state of my health and the health of a lot of my clients.
Yeah, I mean, I certainly don't dismiss the contribution the microbiome has. I just don't know how to evaluate it properly if we know how. And so when you say optimize, what are your endpoints and what are you doing outside of a carnivore diet from, or I mean, obviously many things impact it, including sleep, including exercise, but what other things could you do to optimize the microbiome, and how do you evaluate if you've been accurate? And have you seen and analyzed carnivore microbiomes versus other microbiomes? And can you have a general commentary on the relative, I guess, the relative good or badness of it, I suppose?
Yeah. So the American Gut Project is a website, I think, is still offering the ability to sequence your microbiome, and it's imperfect. It's early on, but it's affordable, so the average individual can take a look at it, and you make contributions, evaluations, I should say, to looking at your particular sequence microbiome. And they don't sequence all of it, but they sequence enough to infer and draw conclusions about how healthy your microbiome is. And they compare it to other diets, so vegan diets, vegetarian diets, and other people that are eating a similar diet to you, with similar age, similar race, similar location. So there's a lot of interesting comparisons that are made in there. But one interesting was a guy named Michael Pollard, who is on the internet a lot as somebody who's a microbiome enthusiast. So they make a comparison to your microbiome, and actually mine was significantly better than his. So he's like the gold standard, but I am a freak about the microbiome. Patrick, Found My Fitness, is also a freak about the microbiome, and I see her talking a lot and bringing up to her guests, and I can see the disappointment when a lot of them aren't very interested in it. But you ask the questions, how do you optimize it? So the first thing I tell my clients, and I would share with you and your audience, is stop harming it. So one of the ways that you harm it is when you eat processed foods. And there are so many food preservatives, and the way food preservatives work in processed food is to keep it from going stale and rancid. So you have to understand that bacteriostatic and bactericidal processes from those food preservatives that have been cleared by the FDA as maybe not in vivo or in vitro causing problems to human cells, to look directly at human tissue. What they do harm is your microbiome, your very, fragile, delicate collection of organisms that are inside your body. And so to keep that food from becoming rancid and stale, it prevents bacterial growth and impairs growth and kills things off. And that unfortunately means it's going to destroy your microbiome. So it's just elevating or educating people's awareness, about all, the bad players that, cause problems. And chlorine, just chlorinated water, drinking water from plastic bottles, and microplastics, and all of the different bad small amounts of exposures over a period of time. We might be able to get away with it as a big organism, but are these little tiny fragile one cell organisms inside our gastrointestinal tract and on our body and our skin, they are a lot more exposed. So I think I only drink water that's triple filtered, so that I don't I don't have chlorine and fluoride and these chemicals coming into my body. And I recommend, you know, the same thing on outside of your body, having, you know, filtered water, you know, to eliminate the destructive harm that microbes, you know, sensitive, beautiful microbes you have on your skin that provide a very effective barrier to pathogenic microbes like MRSA, methicillin-resistant Staph aureus, and vancomycin-resistant Enterococcus VRE, and some of the bad players. We would see nosocomial infections in the hospital. The more we clean, the more these infections persist. But if you create a healthier bulwark, a barrier, so to speak, on your skin, these bad players can't grow because you have a lot of healthy microbes on your skin. And so it crowds out the capacity for MRSA and some of the other pathogenic microbes to live on your hands and on your body and your skin. And that same theory applies to your gastrointestinal tract. So you want to optimize the amount of really good ones down there, not by not harming them, and then also make positive contributions. And one big positive contribution is through fermented foods. So eating a lot of probiotic rich fermented foods, not probiotic supplements, because I think too often those are driven for profit. But if you eat a lot of fermented foods, and they are the only vegetables I am eating right now are fermented vegetables, and I eat small quantities of them every time I eat to make a positive contribution of effective microbes. And although I haven't seen studies, I would like to see studies to look at the ability of fermentation to help diminish some of the threats that we see from plants and vegetables, like in plant defenses, lectins and phthalates and saponins, and some of the other plant defenses that we're finally talking about and looking at, I think may be mitigated substantially by natural processing through fermentation, and maybe co-ingestion. Professor Dr. Bill Schindler, I think he's with Washington University or Wheaton University, I forget what one it is, out in Maryland. He may be been with you, but he's done a lot of fascinating work and on eating co-adjusting vegetation with other things to help diminish the toxic effect of these plants. So I generally just stay away from them, you know, unless they're fermented. I don't think we really need plants. I think the carnivore community is showing that, and I'm super excited to see what the Harvard study and other studies that we're going to do in the future with carnivore, the role plant elimination is going to have on human physiology.
Thanks, Sean. That's been very enlightening. Can you tell people where to go to find you and your information?
Yeah, so I'm on Twitter and I'm on Instagram at Dr. Sean O'Mara. So just at DRSEANOMARA. I also have a really lousy website because I put my money into my research, and you know, I'm not in marketing. My problem is I'm not a for-profit. I'm not into profit. My fascination is science. So I've been not good about developing a nice website, but you can take a look at that also. It's just www.con wellness, WELLNESS.com. I have many of the photographs that I showed with you and shared with you today are on my website, and you can get a hold of me. And I'll make a pitch. If you are motivated to be the very best performing human being in your area, or whatever expertise that you have, I would like to work with you. I think you're super interested. We need to figure out why you're that way, and we need to get you better performing. So I'd love to work with you. But if you're just somebody who wants to perform better, look better, and get healthier, I'm willing to work with you too. So, but yeah, I think we need to find these models, find these people, start promoting health optimization to make it, you know, much more attractive than just being a professional athlete. We want to model health optimization, because across the board in everything, Sean, to help people perform across the board, better architects, better attorneys, better physicians, better baseball player, better whatever you're doing. If you're healthier, you're going to perform better.
I can't disagree with that. Thank you guys so much. Thanks, Sean. Hopefully we'll get you back on here down the road. I'm going to end this for everybody. You guys have a great day, and we'll see you back tomorrow. Okay? Take care now.
All right. Thanks, Sean.